primary nurse finds their patient unresponsive and pulseless. They press the internal code button to notify staff of a need. The nurse will then place a surgical mask on themselves as well as the patient to decrease exposure risk. The bed will be pulled away from the wall. And the headboard placed under the patient if we are able. The nurse will now begin CPR. This nurse will remain in the room for the length of the code and will be part of the code team. The charge nurse on the floor has responded to the internal code button and will provide the nurse with the appropriate PPE, if not already donned. They will also designate staff members to retrieve the IO, the code cart, and notify the attending of the patient's condition. The code cart will remain outside of the room for the entire code. Respiratory therapy and the CCU nurse have arrived to assist. Respiratory therapy is responsible for bringing in the aerosolized airway kit into the room and will immediately place an LMA. The CCU charge nurse will take the responsibility of the nurse team leader, as well as medication administration and the defibrillator. The senior residents and attending have arrived. They will also take turns as compressors as needed. The primary nurse is now able to don their appropriate PPE to decrease their risk of exposure. The therapist may ask for compressions to cease while they are placing the LMA for a short period of time. There are runners outside of the room that will be communicating with the code team in the room through the nurse call system. There is also a resident or nurse at the nurse call system to assist with communication and needs in the room, as well as recording. ACLS guidelines will be followed for the length of the entire
Can
code.
everybody clear the patient? Shocking. Shock delivered, resume compressions. Alright, so if we could drop a milligram of epinephrine, please.
Compress faster.
Milligram of epinephrine is ready. Person on the outside, could we get an IO to the room,
Compress
please?
deeper.
Requesting IO on its way.
Milligram of epinephrine is in and flushed. Perfect.
If vascular access is needed, we will be utilizing the IO for this. The residency team will place the IO.
Without sign of compression.
Alright, so this time we just start summarizing. It's started. The rhythm pad is given a shock and is given a recovery. We've got an element placed. We're coming up on our next rhythm check. So once we're about there, you could just take a pause and check the rhythm.
Right.
Yeah, rhythm check. 2 minutes of elapsed. 10, 9, 8, 7, 6, 5, 4, 3.
Once return of
2,
spontaneous
1.
circulation is achieved,
15 seconds. Without
the team
sign
will
of
prepare for the
compression.
transfer of the patient. The clinical administrator has been outside of the room and will act as a liaison to CCU and to the CCU attending. They will not be part of the in-room code team.
30
Person on
seconds.
the outside,
Without
can we get
sign
an
of
oxygen
compression.
tank, please?
All items that have been utilized during the code will be transferred with the patient to CCU, such as the med tray, the defibrillator,
45
the
seconds.
IO,
Without
and the
sign of
aerosolized
compression.
airway kit. The CCU nurse and the respiratory therapist will be the first to exit the room.
60
They will
seconds.
dock
Without
their
sign of
gown and
compression.
their gloves, maintaining their face shield and their mask. They will then perform hand hygiene and they will be provided a new set of gloves by the charge nurse outside of the room. Once they have their new PPE, they will prepare to transfer the patient. They will receive the patient outside of the door from the remaining team members in the room.
Oh, yeah.
They got it.
A clean sheet will be placed over the patient and the supplies to ensure that a decreased risk of exposure during transfer is happening.
I know, but we don't want that kind of.
Once the patient has been received by the clean team outside of the room, the remaining code team members will also doff their gown and their gloves, perform hand hygiene, their face shield and their mask will remain.